Hi, I'm Bethany and today I'm going to be showing you what is in your 21D goodie bag. So on your day of surgery, we will provide you with your goodie bag. Inside, you will have your post-operative instructions. This will give all information and advice after surgery. First things first, after surgery, bleeding will depend person to person. However, oozing is very, very normal. If we are going to wipe around the area for the bleeding, we want to be using the sterile gauze. If we do get quite a lot of dribbling, because we're very, very numb and oozy again, then you can use the sterile gauze provided, fold it up and place it inside and bite down. Next up, after surgery, is your ice packs. This is very good for any swelling. Swelling will depend again, person to person. However, you can use your ice pack, gently squeeze, and it will go cold, and then you can hold it on the area like so. Only hold it on each area for 15 minutes so that you don't freeze the skin, and then move it again to a different area. As well as the disposable ice packs, we also give you a reusable one. You can pop this in the freezer for around an hour or so, get it out, use it just like you would with the disposable ice packs, and then you can pop it back in the freezer for an hour or so, and again, use it again. Only after 24 hours, you want to be using our 21D BlueM Kit. Inside our kit, we will give you your oxygen fluid BlueM mouthwash, your soft toothbrush, your BlueM oral gel, and your BlueM toothpaste. After 24 hours and after 24 hours only, you want to use your soft toothbrush with a pea-size amount of the toothpaste provided, and you want to gently brush around the prosthesis. Be careful not to brush your gum line, as that will still be healing and we don't want to aggravate that area. If we get any sores or ulcers in the mouth, we can use our BlueM gel, which is provided. Be careful not to put your finger in your mouth and just use the nozzle on the end of the gel to apply to the affected area. We also provide the oxygen fluid BlueM mouthwash, and we want to be using this to swish our mouth from side to side at least 3 to 5 times a day. We don't want to be swishing vigorously, as we don't want to dislodge any clots that may be there. We also provide another mouthwash, which is the Cliniset mouthwash, and we want to use this to relieve any soreness in the mouth. This is really, really good for soothing, numbing the area if we're in any pain after our surgery. After 3 weeks, you want to swap from your soft toothbrush to the electric toothbrush provided. This comes with a charger and it will do the action for you. You want to use your BlueM toothpaste. Make sure if you are swapping from your BlueM toothpaste to any other toothpaste, you want a non-grit toothpaste. With this, you want to again apply a small pea-size amount and just gently brush over the prosthesis. Again, after the 3 weeks is up, you want to start using your water flosser, which is provided. So you want to attach the nozzle to the water flosser and fill with water. Be best to do this in the bathroom if it is your first time, as it can get quite messy. This will really help to dislodge any food or debris that is stuck underneath the gum line and the prosthesis. So that is all that is in your 21D goodie bag. I really look forward to seeing you hopefully on your surgery day and wish you the best of luck. Any issues at all, then please read the instructions provided. If you need any other assistance, then please message your treatment coord and they will get you the advice that you need. Good luck.